do you decide when to do that screening or not? Is it just a feeling you get, or?
Well, you know, this is interesting because we've sort of instituted this the last 3 months in our practice. And so a lot of the providers said, well, you know, I'd rather, if I really know the person well, or I think I know them well, can I just not do it? And we're trying to get it in as a regular protocol, especially for new patients, or if they've had a history, or if they're on any type of controlled substances at all, whether from us or somebody else, because you don't know. You're not a good guesser at who is at high risk for use and who's not. It's really been pretty eye-opening. So, and you know, using recreational marijuana is acceptable from a large amount of folks out there, especially, you know, we got Colorado on that. So to them, they really aren't, even if you ask them, it's just to them so acceptable that they don't even want to talk about it. So, but once you say, well, we're going to take your urine and it's not legal, but we're going to send you to the lab. And so if you just tell me, at least I know what we're dealing with. I say, well, by the way, you know, I'm on this opioid from this doc, and I do a little bit of marijuana, and I do this. And it's, we've had a lot of answers changed. I had a person who was just out of, went out of state to a long rehab, a pretty young kid, and he's back in town, and he's working, and he's doing well at his job, and he comes in, he says, oh, I'm just doing so great, I do a little bit of marijuana. Well, he has all sorts of opioids and all sorts of stuff. He says, well, I took a little Subutex, you know, I had a little bit of that left over, and so we drug test him every time he comes in, And today he was doing pretty well, but the last time he was in, he was telling me he didn't do anything. He was sniffing, and he was doing all sorts of stuff, and I knew he was on opioids and stuff, and he sure enough. But you know, it's just, but as long, I think the important thing is, but we're willing to treat him. You know, if we kick him out, he's not going to get help, and he's not on any abusable substances from us or anything. But he keeps coming, and we keep talking about it. And it's gotten less and less and less as we've gone through. So, you know, it's not like we just kick them out the door because they have a positive urine. So realistic expectations. So this is just another way to look at the psychiatric assessment in different areas. You know, physical activity is a big thing, both from a mental health standpoint and afterwards, what they're going to be doing. Do they have any plans? Do they have anybody they know that they can hook up with for the gym, things like that? Do they have a social support network, folks that they can call and connect with? Are they socially isolated? They don't really have a friend network. They have a lot of social phobia. Are we going to have to sort of create sort of things for them? So those are things that we think about. And motivation and expectation, you know, how motivated, you know, a lot of times they're motivated to want the surgery. Are they motivated to go through what's going to happen afterwards? And talking through with that is, and at least putting that in their mind if they're not, starting to build that is, so you have something afterwards to hold them accountable for as you work in this partnership together, is pretty important. So what patients want, you know, everybody wants to feel better about themselves, have more energy. I don't like to say as we get older, as we mature, we don't have as much energy. So be happy, you know, not feel depressed. People like to be on less medications. Luckily with the surgery, a lot of folks get on a lot less medications physically. Mentally, for their mental health, medications tend to stay pretty consistent over the next year, first year after surgery. They tend to decrease after that some, but you can decrease that amount of meds that you might need for mental health wise because absorption and stuff changes. So you might need more of meds doses beforehand, you might need less afterwards, and you might actually be more sensitive to the positive effects of medicines afterwards. So, and then you like your physical symptoms, like your knee problems, all those things to get less. And it's just all a big related loop. So when we have folks come in, you know, if you change one thing on the circle, everything else changes. You know, we're a system. So If your diabetes is under better control, you tend to feel better. Physically, that helps your mental health. So if we get somebody feeling better from a mental health standpoint, depression-wise, get their anxiety down, all of a sudden they're much more compliant. They seem to be more compliant. They're just able to be more compliant with things. So it's sort of the system working together. So the goal of integrated care, right? And this is what I was talking about, social media. Patients are becoming more and more, especially as the younger folks, as they grow up, they go online, they Google all this stuff, they look at what the surgeries are, they look at what people have said about them. So one thing I'm pretty big about is if I have an anxious person, I just tell them, I know you're going to go home, you're going to get online, you're going to go to all the boards, and you're going to go look for the worst things possible you can find about this medicine. So let's talk about it now before you go home and worry about it till you. So, you know, if you address that up front, they're pretty good about it. But it is out there and it's pretty prevalent. When I was doing this, actually, last night I was watching one, and there's quite a few on what do you do with your extra skin after surgery. So I thought it was pretty fascinating, actually. So, but you know, I'd never thought about that because you have all this extra skin. What do you do about that at first? And at first, you know, that's gonna, mental health-wise, you got this body that's greatly changed, and now I have the skin I have to deal with. And so they have this gal, she's taken through a progression from pre-surgery, right after surgery, and then about 6 months afterwards, and then she has this one 2 years afterwards, and she talks about the elasticity of the skin. It takes about 2 years, and in between times there are things that you can do. There's another guy on there who's worked out a lot and changed his body, and he actually went on and raised money so he could get the skin reduction surgery afterwards, and then there's this company that helped him pay for the rest of it, so for this $15,000 total surgery. But it made a huge difference in this guy's life, just huge. So it's sure, they're all on YouTube. They're fun to look at.
We actually wrote an article when I was at USC about internet use of bariatric surgery patients, and it's twice as high as any other patient.
And that was before the internet.
Yeah, and that was
before the internet.
That was really early on. But you know, there were a lot of misconceptions about it. It's because they're sedentary and they use the internet a lot. But I mean, we used to joke that patients that would come to see us probably knew more about us as surgeons because what's out there on the chat rooms and stuff than our families did.
Oh.
Because they're reading about it every day, and it's some good, some dangerous, you know, but it's truly a huge phenomenon. And bariatrics is the internet.
Yeah, I know we're going to add that to our psychiatric assessment because that's something more things to think about when people talk. So, but something you can do things about. So we talked about you know, the 25% who believe that it will just be the miracle cure and they'll never have to do anything. Now, this sort of is important to me that 27% believe there is no need to worry if depression occurs. So, you know, if we think of postpartum depression, depression in pregnancy is one of the highest times to become depressed for women. And, you know, anytime you go through a major change in life, it's a change. And most people don't deal well with a lot of change. And if you get a huge change, even if it's very positive, all of a sudden you get all this attention, and people are asking, oh, this, and this. And some people don't like all that. It can just be way too much. So they are at risk for depression, so it's important to monitor. I mean, it's 27%, so 3/4 of people, if they haven't had that issue, don't. But there are 1/4 of people to sort of watch for that. So they know how to deal with life the other way. All of a sudden I have to deal with life living this way. You know, it's people react to me differently. That's a change. Role of psychiatry, personal goals and expectations. So what do people think? So we sort of talked about all this. This is an important slide just to look at when you get done because it's saying what happens in early life affects a lot about how we end up in later life. And there's genetics and then there's epigenetics. So epigenetics is you take how you are and you're born and then you put on what happens, all the events in your life, trauma, teasing,